Hello and welcome. I'm Christopher Medina DO, and today we'll explore a patient-centered approach to partnering for health behavior change that will transform how you manage chronic diseases like hypertension. Using the 4A's framework, we'll discover how to move beyond traditional patient education to create genuine partnerships that lead to long-lasting behavior change. Let's get started. Picture this. A patient comes to your clinic saying that they want to check up on my blood pressure. Sounds simple, right? But what if I told you this moment could be the key to transforming their entire approach to managing their chronic condition? Here's something that might surprise you. The vast majority of the success in chronic disease management is related to self-care. That means our role isn't to tell patients what they should do, it's to empower them to make changes they're actually willing and able to stick with. Today, we're exploring a proven framework called the 4A's that will completely change how you approach these conversations, focusing on a step-by-step system for partnering with patients instead of lecturing them. The goal here isn't just to check their blood pressure and send them on their way. We want to use the 4A's, ask, assess, assist, and arrange, to gather the right information and create a genuine partnership. But before we dive into the 4A's, we need to understand what we're listening for during our conversation. When taking a social history, there are several critical areas that directly impact blood pressure control. Diet and nutrition. We're specifically looking at balanced eating patterns and sodium intake. The goal is keeping sodium under 2,400 milligrams daily. Exercise. Patients need moderate to vigorous aerobic activity 3 to 4 times weekly, about 40 minutes per session. Substance use. Here we want to consider both illicit drugs that elevate blood pressure and alcohol. For alcohol, that's no more than 2 drinks daily for men, 1 for women. Tobacco use. We should ask every adult about tobacco and offer support for cessation. Occupational factors. Job schedules can interfere with medications, diet changes, and exercise. Stress management. Financial pressures, scheduling conflicts, and family dynamics all impact adherence. Social support systems. Without support, lifestyle changes become much harder to maintain. And finally, spiritual and cultural considerations might affect how patients understand their condition or accept treatment. Now, when you identify these risk factors, here's a respectful way to bring them up. Your diet, exercise, or stress levels may be contributing to your high blood pressure. We can talk about that in a little while if that's okay with you. Notice how that invites discussion rather than creating defensiveness. Now for the heart of our approach, the 4A's framework. This works best during your recommendations, and it's going to transform how you communicate with patients. Step 1, ask permission. Step 2, assess readiness. Step 3, assist with behavior change. Step 4, arrange for the plan and follow-up. But here's the critical mindset shift. Focus only on what patients are willing to do. If you push your agenda on what they don't want to do, you're wasting everyone's time because they simply won't follow through. If you find yourself trying to convince or argue with a patient, you've shifted from patient-centered to doctor-centered care. The 4A's prevent this trap. Step 1, ask permission. The first step invites patients to partner with you. It sounds like this. Would it be okay if we talked about some of the things that might be affecting your blood pressure? Or, we've discussed several things that will be important for your blood pressure. Can we talk about those? Then you offer a menu. These are the areas we could work on: medications, diet, exercise, tobacco cessation, reducing alcohol, or stress management. Which would you prefer to focus on? See how the patient gets to choose? That's partnership in action. Step 2, assess readiness. Step 2 uses a simple but powerful approach. Ask, on a 1 to 10 scale, how ready are you to change your diet right now? 1 means not ready at all, and 10 means ready to change now. Their answer tells you exactly what to do next. Scores of 1 to 3 mean they're resistant. You say, it sounds like you're not ready right now. I'd like to give you some more information, and maybe we can talk about it next time. Don't push today. Scores of 4 to 7 mean they're ambivalent. Try, it sounds like you're thinking about it. I'm glad you're leaning that way. What would help you consider it more seriously? Scores of 8 to 10 mean they're ready to change now. It sounds like you're ready to make a change now. That's great. How can I help you today? Let's think about how this works in practice. For stages 1 to 3, the patient who is resistant to change, provide educational resources and ask them to think about your discussion. For example, if they don't understand how sodium affects blood pressure, give them a handout about low sodium diets and ask them to start reading labels. Follow up in 2 weeks. The goal is simply moving them to the next stage. Never argue, threaten, or coerce. For stages 4 to 7, the patients who are ambivalent or inconsistent, offer options like dietitian referrals, dash diet information, or tracking apps. Again, 2-week follow-up with the goal of reaching the action stage. For stages 8 to 10, these patients are ready now. Make your plan today. Provide necessary resources and follow up in a month to check progress. Step 3. Assist with behavior change. Step 3 is where real partnership happens. Start by asking for their ideas. What do you think it would take to move you closer to a 10 to make that change? Then offer a menu of options for next steps and match solutions to their readiness stage. Don't try to push them too far too fast. If you sense resistance, arguments, excuses, or just saying okay to end the conversation, back off immediately and return to being patient-centered. Step 4. Arrange follow-up. The final step ensures ongoing support. Arrange necessary resources or referrals. For patients below stage 8, schedule follow-up in about 2 weeks. This gives you the best chance to help them move to higher readiness levels. For patients at stages 8 to 10, follow up in about a month to allow time for meaningful progress. Let me show you how this fits into the end of encounter summary when done using an S-bar structure. Situation and background cover the usual: patient perspective, pertinent history, control, compliance, and symptoms. For the assessment, you explain the condition in simple terms, ensuring the patient is clear on the disease process we are addressing. My assessment is that you have hypertension, chronic high blood pressure. This is a condition where your body is not able to consistently manage the pressure within your blood vessels. Over time, this puts stress on your heart and blood vessels even when you don't feel it, increasing your risk of heart attack, stroke, or organ problems. Recommendations. Here's where the 4 A's shine. Ask, would it be okay if we talked about things affecting your blood pressure? I see several areas you might be interested in. You can then present your menu based on what you've learned. Which would you like to work on? Assess, on a 1 to 10 scale, how ready are you to insert specific behavior right now? For an example where our patient rates a readiness for diet change at 6 out of 10, we reply, a 6? That's pretty good. It sounds like you're not quite sure about making a change yet. What can I do to help you get ready to move that up to a 10? Your patient will share the ways that you can help them, whether by providing educational materials, referrals, or other resources. And you will finish by summarizing how you will arrange the next steps in the plan and clarify the expectations for follow-up. Arrange. Now our plan is you'll work on that specific area, and I'll provide a dash diet handout or any other specific resources you want to add. Let's meet again in 2 weeks to see how you're doing. What concerns do you have about this plan? The 4 A's framework transforms routine encounters into genuine partnerships. Instead of telling patients what they should do, you're empowering them to identify what they're willing to do, then supporting them in that journey. Remember, successful chronic disease management is primarily self-care. Your job is to meet patients where they are and help them take their next step forward. Here's what I want you to remember. When patients are truly part of the decision-making process, everything changes. They stop being passive recipients of our instructions and become active partners in their own care. The 4 A's framework isn't just another clinical tool. It's your pathway to genuinely patient-centered chronic disease management. It transforms those routine blood pressure check visits into meaningful conversation that can change patients' lives. So here's my challenge to you. Before your next encounter, practice with your friends and colleagues so you can become adept at responding to patients with various levels of readiness. Then try this approach with your very next patient. Ask permission. Assess their readiness. Assist with their ideas. Arrange the right follow-up. You might be amazed at how much more engaged your patients become when they feel heard, respected, and empowered to make their own choices about their health.